This patient was referred to me for endodontic retreatment of tooth number 13. According to the patient, this root canal was done about a year ago. And she has no symptoms. Her dentist thought that she saw something on her x-ray. And I think that's what she's referring to right there, that little lucency right there in the apical area, in the periapical area of the tooth. Let's look at multiple angulation PAs. Number 12, look at number 12. This RCT, according to the patient, was done decades ago. It's not a recent root canal. As I said, number 13 was done about a year ago. Number 12 was done decades ago, maybe 10, 20 years ago, according to the patient. That's another angulation of the, another x-ray, another PA angulation. And again, you can see number 12 and number 13 here. Percussion within normal limits, palpation within normal limits, probings 2 to 3 millimeters. What do you do? What do you do in this case? What do you do in this case? If this is indeed, you think this is a periapical relucency, would you go ahead and redo this root canal? Number 13. What about tooth number 12? Would you redo that root canal on tooth number 12? Would you redo it? Again, the number 12 root canal was done decades ago. Number 13 root canal was done a year ago. And I don't think that's a periapical relucency. Here, look at that angulation. What do you do? So what do you do in this case? That was the question. What do you do in this case? Well, in this case, I've gone over it a million times before. You request x-rays from the dentist who did the root canal or from another dentist that she probably went to. So you want to get x-rays from the tooth from a year, 2 years ago to see what's going on, what was going on up there. All right, so that's what we did. It took us 5 minutes and we got this x-ray. This x-ray is from a year ago, before the root canal was done. And you can see the periapical relucency was much, much larger compared to the periapical, that little tiny periapical relucency that we see today. All right, so that tells me that this is not a periapical relucency associated with an active infection. This periapical relucency used to be much larger and now has gotten much, much smaller. So this is not an infection. This is healing. This is healing. So this is how you go about diagnosing. No shortcuts, and you do it thoroughly. As far as tooth number 12 goes, look at this root canal. Remember when I was telling you pretty white lines on an x-ray don't mean anything? Well, now you see why. The obturation is horrible, but perhaps maybe the dentist did a good job with instrumentation, cleaning, and shaping of the canals. The obturation is lousy, so what? For some of you, obturation is the ultimate goal. You just want to create pretty white lines on an x-ray. That's your goal. So you take shortcuts, or you don't follow or adhere to the fundamentals of endodontics. You don't use a rubber dam. You don't use 5-6% sodium hypochlorite. You don't irrigate enough. You don't recapitulate. You just want to go straight to obturation and create those pretty white lines on an x-ray. Again, pretty white lines don't mean anything if you didn't adhere to the steps before creating those pretty white lines. And again, you can see this is an example right there. Okay, so obturation is important, but so are the steps that you have to take before the obturation part.